beyond regulation, UNICEF calls for social and behavioral changes initiative. What models or programs have successfully helped families and communities shift towards healthier diets?
Social scientists who work on these behavioral insights have been very clear that social behavior change on its own can neither make people eat healthier diets, more nutritious diets, nor stop eating the unhealthy diet. So you need to combine the social and behavior change with the food environment policies. So our models of SBC, of course, in combination with those policies, they blend youth empowerment, so really working with young people so that they understand how their food environments are influencing them and what they can do. We use human-centered design to engage people and use their own behavioral insight to help design the messages.
Now, across Africa, the battle for children's nutrition has entered a dangerous phase for the first time in history. Global childhood obesity now exceeds undernutrition. According to UNICEF's Feeding Profit report, ultra-processed food, UPFS, and sugary beverages are rapidly replacing traditional nutrient-rich diets, driven by aggressive marketing, low prices, and policy loopholes that fail to protect vulnerable consumers. Now, this shift threatened not just child health, but the continent's future workforce, productivity, and healthcare sustainability. This episode of Just Africa seeks to unpack how Africans can reshape its food environment to protect children and adolescents. The objective is to explore evidence-based policy actions from food marketing restrictions and taxes on healthy products to stronger labeling and social protection systems that can rebalance diets and curb rising obesity trends. Now, on this segment of discussion is reshaping Africa's food environment for child nutrition and health. Joining us on this discussion is Christiane Rudet, Regional Advisor on Nutrition, UNICEF Eastern and Southern Africa. So glad to have Christiane Rudet.
Thank you very much for having me, and delighted to talk about this topic with Souk News today.
All right, thank you very much for joining us. So let's start off. Now, the Feeding Report, How Food Environments Are Failing Children report, shows that in 2025, now for the first time, global childhood obesity exceeded underweight. How did this research reach tipping point, and what does it reveal about how food environment has evolved in Africa?
Indeed, that's a great question. And it's not that we didn't see this coming. We did see this tipping point coming. And the trend shows that while underweight among children under 5 has been steadily declining since 2000, overweight among children 5 to 19 has more than doubled from 194 million children to 391 million. And the global and regional responses have remained inadequate and insufficient. So globally, by 2025, obesity at 9.4% overtook underweight in school-aged children and adolescents. Now, in sub-Saharan Africa, around 58 million children under 19 are overweight, including 18 million living with obesity. And without urgent action, obesity will also overtake underweight by 2027 in sub-Saharan Africa among school-aged children. How did we reach this? Well, this situation is driven by rapid retail expansion and globalization of food. We are seeing communities being saturated by cheap, ultra-processed foods, sugary beverages, fast food. And this, in Africa, urbanization and this commercialization, this globalization of food systems are replacing traditional markets that sell real food with fast food outlets, supermarkets, kiosks selling packaged foods. We have done some analysis of the trends, and we see that up to 40%, for example, in Tanzania, we've seen a 40% surge in these ultra-processed foods and sugary drinks. And 8 to 10 of the foods on the shelves in Tanzania and also Zimbabwe and many other countries are these ultra-processed, convenient, unhealthy foods.
So it's ironic because before now, we would have said, A child who is looking very skinny is not eating well. And then you need to feed them well so that they can look bulky. Now they look fat, and then we're seeing another kind of problems. What are the health implications of some of these foods, ultra-processed foods, that our children are exposed to and then they consume?
So a child who consumes a lot of unhealthy, ultra-processed foods, high in sugar, saturated fats, high in salt, develops many health issues. First of all, of course, overweight and obesity, which is a problem that drives a lot of non-communicable diseases like diabetes and heart disease, hypertension. And these conditions are showing up earlier and earlier. And a child who was overweight and obese in childhood has a much higher risk to have these conditions later. We also see issues of mental health, bullying, stigma, and school performance, but also employment performance can really suffer. And then, of course, for the society, the costs are huge. The costs of non-communicable diseases that are driven by rising rates of overweight and obesity cost economies trillions of dollars through healthcare costs, lost employment, mental health costs, and many other factors that make this a really expensive proposition for the economies of a continent where we cannot lose so much of our economy to a health condition that is preventable.
It's obvious, right? So corporate organizations tend to do advertising, use different platforms to create this impression that whatever it is they are selling are healthier to kids without telling you the implications of it. How have they been able to convince the young children, even the parents, that these are healthy foods?
The strategies are multiple and they're smart. I mean, you have very aggressive marketing that make the products desirable, not necessarily calling them healthy, but making them aspirational, happiness, fun, social life, all of that. So these are some of the tactics using a lot of digital media. We have been looking at this using influencers and, of course, embedding the products into schools. So you have a school environment both inside the school and outside the school that are becoming more and more saturated with these products. And the marketing tactics are very clever to make the products aspirational with using the tactics that I mentioned. And we've been really looking at this to see exactly how this is being done. And this is reaching even rural communities that may not have as much access to shops, to markets, and to digital media. But the techniques of bringing the foods around schools also gets children hooked and creates that aspiration for these products.
All right, thank you very much. Now, according to UNICEF's Feeding Profit report, it highlights inequities. Poor children are more exposed to cheap, ultra-processed food, while healthy foods remain unaffordable. How can government bridge this nutritional inequality?
So we have seen, of course, as you say, that the ultra-processed global market foods are becoming more and more cheaper as the real foods become more and more expensive. So first, we think we need governments to act across multiple systems: the food system, the health system, education, social protection, the fiscal aspects of government. First, we think that governments should redirect some of the subsidies and incentives that they give to commodity crops like refined grains, sugars, oils, towards the local production, minimal processing, and distribution of healthy, nutritious, nutrient-dense foods, especially for small children. Small children need, small quantities, but very highly nutritious, nutrient-dense foods. So at least some of the subsidies could be redirected towards making healthy foods more affordable. So Secondly, fiscal policies can play a corrective role by taxing unhealthy foods. And you were talking about tobacco taxes before, alcohol taxes, so all these health taxes. Using that revenue from these taxes could subsidize and provide these incentives for healthy foods, and could subsidize social protection programs that also make sure that the poorest families are able to access healthy food, so with targeted social protection measures. And then finally, our Feeding Profit report urges governments to protect the policy spaces for food policy from food industry interference, to prevent commercial forces from shaping children's diets. The marketing that I talked about in all the different spaces, including schools, is really having a major role to shape children's diets towards these unhealthy foods.
All right, thank you. Now, from the same report, one of the recommendations is enforcing International Code of Marketing of breast milk substitute. How well are African countries implementing this, and what barriers remain?
So we have the WHO UNICEF report, the state of the code, and it says that 34 countries in Africa have adopted aspects of the code. Only 15 have adopted the full measures of the code. 15 countries have no legal measures at all, so they haven't passed any national laws. But even those that have laws, the implementation remains quite inadequate and inconsistent. So you have weak monitoring systems, you have many industry violations, and you have a lack of effective legal sanctions. So those are some of the barriers. If the sanction is only a very small fine, the companies just budget for those fines and keep on violating the laws. So we urge governments to enact regulations that are effective, that have teeth, that go with these national laws, have an effective monitoring system, and then consequences when violations are found. In countries that have very strong sanctions, where in some cases the CEO of a company might even go to jail, or the company gets deregistered, or really effective sanctions, the companies themselves, the industry sees this as an effective barrier to expanding their market. We see it as effective enforcement of legislation that actually helps protect children.
Earlier on, you mentioned, you suggested that a government should try as much as possible to subsidize some of these homegrown food. So how do you think the government can wade in subsidizing, whether it's whole grain, against importation? Because, I mean, for Nigeria, most of the foods we consume are imported. So how can the government, create this balance?
One of the initiatives that we think will really be a game changer is a new initiative that was launched last month in Benin. It's called First Foods Africa. And governments have a vital role to support initiatives like that. So First Foods Africa it has three main pillars that will, first of all, incentivize local production of safe, nutritious, age-appropriate, affordable, sustainable first foods made in Africa with local ingredients. And this should receive investment from the government, but also investment from commercial entities and IFIs and philanthropies that can help de-risk the investments to local African companies. So we're aiming to build a big network of suitable African companies. We did an expression of interest, reaching out to 1,500 companies in 14 countries, including Nigeria. And we're now screening those companies for the kinds of portfolio that they make, as well as the financial viability, to then recommend them for investment, this blended this blended type of investment that governments can also strongly support. And then give them not only investment, but also technical assistance and business advisory services that will help them compete, will help them make those nutritious foods, those healthy foods, aspirational for communities, make them widely available, and really make them reach every corner of the country, just like the unhealthy foods do. Governments can also align their policies and standards to protect young children. This would include the safety, the nutrition quality, the labeling, marketing, regulations, and trade and fiscal incentives to give them tax breaks, for example, if they are making healthy foods that young children need. And of course, governments can put in place policies to link nutritious foods to social protection and humanitarian pipelines for the most vulnerable. And governments can support social marketing that uses the same kind of tactics that commercial marketing uses to really make those locally produced healthy foods aspirational as well for families to buy them for their children and to celebrate culturally familiar local foods that are coming from your country rather than all this imported stuff.
Dr. Redot, I do see that some campaign has already been done by UNICEF in communities. However, are there evidences to show that, some of the advocacies you do, like front of package labeling, taxes, restrictions, or some kind of marketing to people, have there evidences to show that these work? Have you seen any of them?
Yes, there's a lot of evidence that shows that they do work. So I'm just giving you some figures here. So, for example, in South Africa, there was a sugar tax already several years ago, a sugar levy. It was set lower than WHO recommends. WHO recommends that the levy should be at least 20%. And in fact, their new initiative to try and fill some of the gap of development finance actually proposes 50% levy to generate a lot of revenue. In South Africa, this 10%, 11% levy cut sugary beverage purchases by almost 30%. And it halved the sugar content of packaged foods because companies, when they are set a tax, they will reduce the level of sugar to stay below the threshold of the tax. So they reformulate the products. If you go through a South African supermarket, a lot of the marketing on the package is lower sugar, low sugar, no sugar. So it means the companies adjust the formulation of the products because these mandatory regulations come in. We have a lot of evidence also from Chile and from Mexico, which shows that the warning labels and marketing restrictions reduce the exposure. We know children are highly susceptible to advertising.
Yes.
It reduced the exposure by over 70%. It reduced purchases and, of course, spurred the reformulation as well. Same for Mexico. And even in lower income households, because people always say, well, things will become expensive for the poor. But the companies also, they make different products. And the poor, they reduce their purchases of unhealthy foods. And we know that as countries' economies grow, it's more and more the poor of the population who are increasingly buying these unhealthy foods and becoming more and more impacted by overweight and obesity. So the purchases in Mexico benefited, the reduction of purchases benefited the poorer populations even more.
All right, Christiana, I want to read out a comment from one of our followers on YouTube. He's asking a question. He says, what is then the acceptable weight for a child as regard to their age? And what is the required weight for an adult? And when exactly can it be called obesity?
So there are very carefully developed standards that the World Health Organization has indicated for different ages, based on extensive research and evidence of how a healthy child would grow and how much they should weigh relatively to their height and to their age. So these standards are set by the World Health Organization, and they for different ages set what the right weight should be, what is below normal, and what is above normal. And this varies by if it's a girl or a boy, and of course varies by age. So all of those standards are available. Of course, for adults, we have the body mass index that sets standards for adults of overweight above 25%. Above 25, of course, is considered overweight. Above 30 is considered obese. And that is based on the height and the weight of the person. These are set as global standards because they're based on evidence that has been gathered from many different countries. So sometimes people might say, oh, but our people are different. But remember that the standards are compiled based on extensive surveys of populations, wide population surveys that set those standards then through the median of all different populations that were studied.
Okay.
All right, thank you very much. Now, beyond regulation, UNICEF calls for social and behavioral changes initiative. What models or programs have successfully helped families and communities shift towards healthier diet?
Social and behavior change draws on social science that looks at behavioral insights and what motivates people to change their behaviors. And we always say that social and behavior change on its own cannot really get very far unless you also work on the environment where people live and work and play and learn. So you need to do both at the same time. And social scientists who work on these, behavioral insights have been very clear that social behavior change on its own can neither make people eat healthier diets, more nutritious diets, nor stop eating the unhealthy diets. So you need to combine the social and behavior change with the food environment policies that we talk about, the sugar taxes, the labeling, marketing, school food environments. So our models of SBC, of course, in combination with those policies, they blend youth empowerment, so really working with young people so that they understand how their food environments are influencing them and what they can do. We mobilize and engage communities. We use human-centered design to engage people and use their own behavioral insights to help design the messages. And of course, we use commercial marketing tactics through social marketing to make the behaviors that we would like to see, the practices, aspirational, culturally relevant, and community-driven. So those are some of the ways in which we will design appropriate social and behavior change communication.
All right, Dr. Rodet. Speaking still on the behavioral changes and I love when we try to translate our policies, but they are based on verifiable data, right? And data is very, very important because it allows you not to guess what the problems are, right? So countries need to fix the problem that UNICEF has spotted. What kind of data do they need to look out for and aggressively get so that they can make informed policies?
So in the report, we have called for standardized, robust, objective, and regularly collected indicators on children's, adolescents, and women's diets, including the proportion of diets, like what are the ultra-processed and unhealthy foods that people are consuming. And we have carefully designed indicators to ask people what they ate using 24-hour recall, for example. We also look, of course, at overweight and obesity trends, and we undertake surveillance of food environments, looking at the availability, the pricing, the marketing, the retail and school exposure to ultra-processed foods. The Tanzania and Zimbabwe studies I was referring to carefully photograph and assess all the packaged food in different kinds of retail environments to look at what is available, and of course looking at trends, to what extent, for example, have sales of unhealthy foods in different markets increased. We also urge that governments track the policy adoption and enforcement, and also track industry practices. Now, the data on the nutrition status of school-age children and adolescents in many countries is actually missing. So that's a really important gap that needs to be filled.
Okay. So, I mean, still on it, doctor. Yeah, I understand data is very, very important, right? But I wanted to get your take on something that looks like another campaign, right? Genetically modified foods. Right here, we will say young people are being at the forefront of trying so hard to object eating anything that is genetically modified. What is your take, especially when you see that we need to get and eat healthier foods and it's competing with genetically modified foods? What is your take on that?
I'm not an expert on the details of the science, but I think any recommendations on GMOs need to be based on evidence. Just like all the recommendations that we support. Does the particular form of genetic modification, does it harm health? And that is the main consideration. And I think there are different types. You modify the crop to be more resistant to drought. You can biofortify foods. You can do many different things. You can genetically modify the crop to be more resistant to certain pests or environmental conditions. Any recommendation that we make should be solidly based on evidence. Just like with ultra-processed foods, the evidence on health harms the body of evidence is still growing, but it's now becoming very clear with foods that there are very clear health harms. So the same applies to GMOs, as the body of evidence on the impacts on human health of different forms of genetic modification if that body of evidence is growing, then we will have clearer recommendations to say, no, this is bad for human health, and therefore we should avoid all GMOs. But if there are some aspects of modification that are actually health supporting or protecting, then we have to also convey that nuance that not every GMO is harmful, and maybe some things are more harmful than others. So I think there's not an easy answer that's black and white here.
Okay. All right. So I mean, still with the young people, because I mean, since they are the future of the continent, right? How can we get them to actively participate in promoting some of these advocacies that UNICEF is pushing, especially in terms of eating healthier? How can they be participatory?
So we have some great examples, like the youth-led movement called Fix My Food, which is active in 18 countries, including South Africa. It really demonstrates how the voices of young people can really help shift norms, but also demand policy change. The initiative really equips young people to challenge the harmful industry tactics, to really understand how they are being manipulated to want to buy all this stuff, how their environment is full of unhealthy foods, how they are being bombarded with these in the digital space that so many young people occupy. And, to advocate for these changes through telling the story of their lived experience of their food environment, not necessarily all the technical jargon that people like me tend to use. And we don't... We train young people not to be mini nutritionists, but we really empower them to tell their own stories. And I'll just give you one example of South Africa. The Fix My Food young people collected over 5,000 survey responses from other young people. And in that survey, 86% of the young people surveyed really supported junk food marketing restrictions. We don't want to be bombarded with all these adverts. And 64% of them calling for warning labels on the packages that signpost and make it really clear for people to know what is an unhealthy food. They also collected a lot of signatures in an open letter to the Ministry of Health to also support the legislation that the Ministry of Health is now trying to push through and is struggling with the industry interference that is happening. Yeah. It's taking time. The intent is to derail that legislation. But the young people are also keeping up the pressure for the legislation to be passed.
All right, thank you very much, Christiana. Now, stopping some of these junks into the country might be a bit hard because they keep coming in and Nigerians have this insatiable appetite. So how can the government, do you think that there should be some form of quality control to safeguard some of these things coming into the country? Secondly, what role can schools and teachers play in creating a healthier, balanced diet?
So let me start with the safeguards. I know that there is a whole thing of tariffs happening right now, yes. Which we don't necessarily think is the right way. But if a country and all the neighbors, so this is where I think engaging regional economic communities in Southern Africa, it's the Southern Africa Development Community. There are different development, economic communities can set regional standards, regional strategies. And for example, the SADC community has a regional strategy on the policy measures that governments should put in place. Promoting and incentivizing local is one way, but putting in place the taxes, the front of pack labels, the marketing restrictions, those are all effective measures. So if a company imports something that doesn't comply with the labeling restrictions and is marketing an imported product and is violating the country's marketing restrictions. So I think, short of trying to prevent those products coming into a country, which is difficult to do, we have a globalized economy, but putting national legislation in your country and hopefully the neighbors as well. This will be one of the most effective ways. And to me, one of the benchmarks of effectiveness of a measure is the extent to which the industry lobbies against it and the amount of dollars they spend lobbying against these measures. So it's mainly these that WHO, the taxes, the marketing restrictions, the front of pack labels that signpost that a product is unhealthy, and regulations on what's allowed to be sold and marketed in and around schools. Those are the most effective measures that the World Health Organization, again, has gathered evidence for. So I think schools can be very important platform for really bringing about good nutrition habits in children and transforming habits, because children are in school a lot of the time. They spend a lot of their day in school. The school can help shape nutrition literacy, and food preferences can help set good norms around eating, but you need to align a school food environment with national policies. So junk food should not be marketed in schools, around schools. Of course, the school meals need to be healthy. And we know that, of course, we have what we call corporate capture, where companies will donate a breakfast item for a school. But that's often an unhealthy item. It could be an overly sweetened yogurt or a cereal or drinks. So you capture that audience in the school. So keeping that out of school is really important. Teachers can also encourage discussion and critical thinking about food advertising, food choices, and so on. There was a study in the US where one group was given the standard nutrition education, eat healthy food. The other group they discussed how they're being manipulated by advertising. And then they observed which group reduced their consumption of unhealthy foods more. And it was the group that had discussed how they're being manipulated by the advertising and the food environments. So we think that the school can really play an important role. South Africa, I'd like to again just mention, is leading the way in the Eastern and Southern Africa region where I work by developing a blueprint for improving school food environments, which is now being implemented and is also being evaluated to see if it works.
All right, so Christiana, I was going to ask this question before you mentioned South Africa. So now, apart from South Africa, can you share other examples of countries that have achieved measurable progress, in Africa?
Yes, there are some, and I have to admit that I'm more familiar with Eastern and Southern Africa than other parts of the continent. And we have a number of good examples. South Africa is of course leading the way. So South Africa has a health promotion levy, but Tanzania is progressing with its policy to put in place that levy. Botswana, Comoros, Zambia have low-level levies, but there's always potential to increase them. And then in Zimbabwe and Kenya, there's also some taxes that cover junk food, fast food. Warning labels is something that several countries are now beginning to work on. South Africa is struggling to push it forward, but Kenya is working on one as well, and Tanzania and Ethiopia. More and more countries are working on these.
All right, sorry to cut you short. I did not hear you mention Nigeria. Any particular reason? What are we lacking? Where are we lacking? What sector, what area are we lacking behind in Nigeria?
I'm not so familiar with Nigeria, unfortunately, but at least our office has now started to undertake the landscape of analysis of the policies that should be in place and compare them with what is in place. I think if I may be speaking out of turn, but I think Nigeria has to really catch up with some of the other countries around. I know Ghana has been working on some of these policies as well. But I think it's imperative that the government and other partners in Nigeria also really move forwards to undertake the landscape analysis, to undertake an analysis of how much overweight and obesity and the associated chronic illnesses cost the Nigeria health system and economy, and really make the case on the return on investment if Nigeria will put in place these measures, including the revenue that the government may be able to generate from the health taxes.
What I can acknowledge, though, because like I said, I understand that you're a regional head, so perhaps West Africa may not be your forte, but I do acknowledge that Nigeria has tried to push for the front of label packaging for some of these products. I know it's a policy that goes on. However, how do you see, or what vision does UNICEF or WHO have in terms of food security while we are still trying to push for, availability of some of these healthy foods in comparison to, UPFs?
Yeah, so this is the dilemma that many countries face. It's a double burden. So countries like Nigeria still have a very high level of undernutrition in small children, but also in school-age children, similar to Ethiopia. So the two big population, highly populated countries are grappling with this double burden. So we need to have interventions that incentivize local, nutritious, nutrient-dense, healthy foods, real foods. We need investment and financing for those foods to make them more affordable, available, and desirable. But we also need to make sure that we have the appropriate policy measures in place to reduce the consumption of the unhealthy food. So the countries like Nigeria need to do both at the same time. It's not one or the other is more important. Every country is on that trajectory for overweight to become to overtake undernutrition. And of course, the numbers are high in a country like Nigeria. The numbers of children who are both who on the one hand are living in what we call child food poverty, are eating very inadequate diets, very low quality diets with very little of the healthy foods, the legumes, nuts, animal source foods, healthy ones, vegetables, fruits. Those diets are very inadequate for children to grow well. And at the same time, the nutrient poor, unhealthy foods are becoming more and more part of the diet and are actually displacing healthier foods. So children might be filled up with sort of empty calories and a lot of sugar and energy, but they're not getting nutritious foods that they need to grow well. So we actually need to address these two issues simultaneously and see them as two sides of the same coin.
All right, thank you very much, Christiane Riddet, for your insight, and thank you for joining Just Africa.
Thank you for having me.